Good evening, everyone. So this is Habib from Hassle Free Education, and today we have invited our prominent guest, Dr. Fairoz Fayas, and within a short period of time, we're gonna bring her on the show. And before that, I'd like to share with you something probably that's gonna help a lot. So you have seen the last couple of days ago, you have brought a lot of guests. Um, some of them were the university teachers. I mean, they are very experts in their industry. Two doctors we have brought up, and we have also brought up the IT expert as well. And today I'd like to bring Dr. Fairoz Fayaz. So please comment below if you listen and watch me properly, because I don't like to have any sort of technical stuff going on inside. So we'd like to make sure that you have watched it properly, and you can listen it properly, because last time you had an issue with these things, and hopefully this time it should be okay. Now, within a minute, I'd like to bring up Dr. Fairoz Fayas. So, I think, yeah, so it's absolutely fine. Get it. Yeah, so this is the time to bring her, and I'd like to welcome her right now. Um, just give me a right. Um, Good evening.
Okay.
So right now we are on live, and dear viewers, you have seen that our prominent guest is Dr. Fairoz Fayas, and she's on the show. And well, basically, I haven't got anything to say today, so probably I'll ask a lot of questions to her so that you can get a lot of information by this time. If you have got any questions, please comment below, or you can give us a call 0743 2089544. I'm gonna pass the question to her so that your question will be answered. So, how are you today?
I'm very well, thank you,
Okay.
despite the lockdown.
Can you please introduce yourself? It would be kind enough for us to know about you. Who is Dr. Faros Fayas?
Okay, I've been a doctor. My name is Dr Frisbee. I've been a doctor for now over 20 years. I'm a GP and I work in the NHS, and I also have a private practice doing functional medicine. Um, I've had a long career. I started off in hospital medicine and then moved into general practice, which I find really rewarding.
Okay. Uh, Thank you. Fantastic. So I have got a few questions. I'll go one by one. Can you please share something about your educational journey? How was that? Where you brought up? And now you are Dr. Faros. So would like to know a bit more. I mean, from your childhood.
Okay, I mean, my educational journey was fairly conventional. I did my GCSE, well, they were called O levels at the time,
Mhm.
and then I did my A levels. I did four A levels actually because I enjoyed studying, and then went on to do medicine at the University of Wales, College of Cardiff. Um, I qualified as a doctor back in 1996, um, and then I did my house jobs, and I actually initially started doing hospital medicines and then medicine, and moved into general practice later on.
Mhm. Okay. Okay. So would like to go back from the very beginning. So when you have started your educational journey, you have finished your school and college. So the question to you is, why have you chosen to study medicine? Why not other stuffs like a lot of things, probably engineering, business, IT? Why have you studied? I mean, chosen to study medicine?
I think, to be completely honest, it was a thing that most Asian parents really aspire to. My father's a doctor as well, so it was something that I was familiar with. I enjoyed studying. I was good at doing exams, and I thought that medicine would be a really good opportunity to use all the things that I learned and also to help people. So I went into medicine, and also knowing that there were lots of different fields in medicine as well. So I wouldn't have to just niche down into one area very quickly. I could explore different areas. So helping people using all the skills that I'd learned through my education and having other opportunities, really.
Okay. Okay. So, as you said, you have studied University of Wales medicine. Okay. So you have finished your degree. Then, how did you come to practice? I mean, as a doctor,
Okay.
GP.
So in the 20 years that I've been a doctor, it's changed quite a lot now. We used to do house jobs, which was a year of house jobs, but now you do 2 foundation years. So you qualify as a doctor, and then you do 2 foundation years as a sort of internship. Obviously, you get paid during that time, but you're also interning. So you're not fully registered with our governing body, which is a General Medical Council, until you've done those 2 years. And then what happens is that you choose a specialty. So there's more of a run through. So you don't tend to do odd jobs here and there. You run through in a specialty. So say, for example, you wanted to deal with children's medicine, which is pediatrics. You'd choose a training scheme that would go into pediatrics, or you choose a training scheme going into general practice or surgery, gastrointestinal medicine. So they have run through training schemes now. And on average, I mean, the training, so once you quite, I mean, medicine's a 5-year course. Then on top of that, before you're actually fully qualified and regarded as a specialist, it'll probably be a further 6 years. So it's a long time arriving to the end. And even when you do get to the end, there's always more studying to do.
Okay, so as you have shared that your dad, he was a doctor as well. So is that the only reason he influenced you to be a doctor, or is there any other reason that you loved it and you have seen the lifestyle of your dad and that's why you became a doctor?
I think if I'd seen the lifestyle of if I'd really thought about the lifestyle of my dad, I probably wouldn't have become a doctor, because his hours were very long. We moved so many times. The training schemes went on for ages. There were lots of exams. I think I really focused on the fact that it was an opportunity to carry on learning and really to help people. You're very privileged as a doctor to enter into the lives of your patients and to really make a difference. So I think they were probably the things that really pushed me forward.
Okay. So I'd like to say thank you so much. I mean, you have made your time to share a lot of valuable information with us, and especially, there are a lot of viewers and they haven't got the right information to access in, and probably, I mean, because of that, probably they are lag behind. I mean, what they want to do. So I would like to say thank you very much to, I mean, turn up on the show and giving your time.
No.
And I'd like to ask you next question is. Of course, I mean, you have been to the long journey and you have finished your medical course and you became a doctor. So can you please share with us, can you still remember, I mean, how was your first day in GP?
That was a long time ago. I remember it was actually quite nerve-wracking, because there was me alone with the patient. And in general practice, it is very much you and the patient, in that we don't have lots of people that we can call upon. So it was nerve-wracking. However, patients are generally really nice people. And the nice thing about general practice is that you can, even though the consultations are short, we can always bring people back, and we have a lot of information on our notes. And I think the best thing about actually being a doctor is that you're connecting with people and really finding out about their lives and what makes them tick, and how you can influence them the most. And I think one of the biggest skills to have is to be able to listen and to really understand the circumstances of a person.
Okay. So on this page, there are almost, I mean, 6,000 people, and out of them, a lot of people are watching you right now, and they might have some sort of questions as well. And among them, I would say a lot of them are Asian parents, and they would like to see their children as a doctor in future. So so thinking to back, I mean, when you grew up, like, so when you studied in this school, thinking about that period of time, and thinking also about your family as well. So what sort of advice, I mean, would like to give to the children,
Hmm.
parents, I mean, who would like to be a doctor, or whose children want to be a doctor? So considering the school and college, and what sort of things they need to consider.
I mean, definitely. I mean, you have to have, because there's so much competition for going into medicine. You have to have a strong academic record, but realistically, think about you and other applicants. Other applicants are also going to have a strong academic record, so you really need to think about how you're going to make yourself stand out.
Mhm.
What sort of things, or what sort of activities that you've done or you've experienced that can make you stand out from everybody else, and what sort of things are relevant. I mean, it was quite competitive when I started medical school, but it's even more competitive now. So definitely don't rely just on your academic skills, because everybody that applies to medical school will have 3A stars predicted, or three A grades predicted for GCSE, and lots of A stars in their GCSEs. But really think about what skills does a doctor have? How can I demonstrate those skills? How can I show that I've got the aptitude to stick the course? It's a long course. Show that I'm able to learn. So maybe doing some research projects, maybe volunteering, having empathy with people, and really being able to demonstrate those skills that we would like to see in a doctor, but really in a concrete way.
Mhm.
So, I mean, that might come from playing sports, doing musical instruments, from actually going out and helping with charities and things, but also think about the way that you present the activities that you do, so that it makes it relevant to medicine.
Okay. So the next question I'm going to ask you right now is, a lot of students probably they're doing GCSE right now, or probably they're going to go for the college. So what sort of qualification specifically students need to be a student of medicine?
It actually varies from place to place, but from what I remember, and I know now, is that you still need to do chemistry A level, and then it's good to have a good science background, so probably another A level with a scientific method, so either maths or another science. But then after that, if you do really well with it, if you've got a passion for a particular subject, I don't think that will hold you back. So if you like languages, that's always good. If you like arts,
Mhm.
that's always, it's, as long as you get good grades and you're able to demonstrate how that's relevant to medicine. There isn't really that much of a restriction, but generally speaking, you have to have probably two sciences, or a science and maths.
Mhm. Mhm. Got it. And so just I'd like to share it with you some sort of things. So we are helping students to get into the university, and there are a lot of people. I mean, they would like to do different sort of courses, and a few of them they would like to go for nursing. And when we try our best to get students into the nursing, and especially most of them are immigrant, and I would say they are the adult students as well. Probably they have been
Mm.
a long time in this country, but they haven't got the access to the right education. And when they come to us and we tell them, well, if you'd like to go for the nursing right now, so probably might need some sort of qualification, like equivalent to level 3, then probably English and maths, and that's going to be, I mean, functional level skill too. So still, I mean, we get a few students, they would like to, I mean, be a doctor in this country. Probably they might have some sort of previous education or background in their home country as a doctor.
Mhm.
What sort of advice do you have for them? I mean, still would like to go for this.
Okay. The our governing body, medical practitioners governing body, is the General Medical Council, and if you look on their website, there'll be lots of information about what sort of qualifications meet their requirements. One of the first tests that they need to do is to demonstrate they've got adequate command of English. So they have the GMC actually put an exam in place for that, and there's lots of information on the website, but then also looking at different forums as well, because it must be, I'm sure there's PLAB forums, so there's the linguistic exam forums, and also maybe trying to find some doctors that have qualified overseas, they're international medical graduates, and then they've got into the system. But there's actually there's quite a lot of resources available. So if you look for courses, if you look for books on meeting the requirements, there's a huge amount of information available.
Okay. So now I'd like to take you for a different sort of question. So, due to the COVID-19, everything is locked down.
Mm-hmm.
People, I mean, a lot of people, they don't know how to spend their time. And probably most of the people, I mean, they spend their time on social media and probably watching the funny things and stuff. And this is how, I mean, they wasted their valuable time. And we know, I mean, the lockdown will be gone and everyone will, I mean, jump into their profession. So right now, I mean, there are a lot of people, so they would like to develop their some sort of skills, and they would like to, I mean, be mentally healthy as well. So what sort of, I mean, advice do you have for them? I mean, particularly in this question, so how can they take some sort of courses or do some sort of things so that they can develop their skills, and when things become normal, they can jump into their profession?
What I would do is I would actually work backwards. So think about what skills they need or where they want to be in terms of their profession, and work backwards and say, well, if I want to be in that particular position, what skills do I need? How will I acquire those skills? Is there a course, or is there somebody that I can follow? Because sometimes it's not always a course. Sometimes you can follow a particular person on Facebook or Instagram, and they give you lots of hints and tips. A course is a really good way of doing it because it means that you build up from step 1, step 2 in a systematic fashion, and often you get certificates as well, which is really good. And there's a lot of places offering free courses or very discounted courses, so that's actually a really useful thing. But what I definitely do is work backwards. Think, well, where do I want to be, and what skills do I need to get there? And then how can I acquire those skills, whether it's through a course or through following a particular person. In terms of mental health, myself and a friend of mine, we're doing a series of conversations. It's primarily focused on Ramadan. It's called Under Wraps, and we'll be doing that through Ramadan. So if there's any people that would want to follow it, that'd be really good. We're covering a lot of mental health tips and health education, medical education tips, and it's not specifically for Muslims. I mean, obviously it's in the context of Ramadan, but everybody's welcome to listen to it, and that'll be on my Facebook page. And I think there'll be some really good resources because we'll reference them as well.
Okay. So I'd like to read some comments. So Muhammad, he said, good evening, Muhammad. And Ahmed Abu, so he said, good evening, Dr. Faiz. So my question is, what and how many academic grade need to access for the studying at medical science? So do you have any particular answer for that?
So generally you need level 3 qualification, which is A levels. But if you've done a degree beforehand, it may count because all the universities have different point systems. So if you actually think of, say you want to do medicine, you choose a university that you want to go to do medicine, and you look under their course requirements, it will tell you. But if you're going straight from sort of school to college to university, it's normally 3 A levels at grade A.
Okay. So, dear viewers, you are watching and listening to Dr. Faiz. If you have got any questions, please comment below. We're going to read for you and she's going to answer. So, right now, I have got a few questions. Is very relevant to health. And, due to COVID-19, a lot of people, they are scared, they are afraid of going outside or doing some sort of things. So, particularly, can you please give us some sort of advice to be healthy physically? I mean, to be fit during COVID-19.
Okay, and I think sometimes we think that we need to be very complicated about this, but actually it's really simple things. We're eating well and healthily. We're not overweight. Being overweight is a big risk factor and a big problem if you do contract the illness. So making sure that we're not eating too much, we're not eating too many carbohydrates, which tend to pile on the weight. We stay hydrated. You're not drinking too much alcohol, because again, that can cause problems. Stress is a big thing, and I'm glad that you mentioned mental health, because stress actually reduces your immune system and it can make you more prone to having infections. Exercise is really good, and the government's allowed us to go out and go for a walk, and I definitely encourage people to do that, because we want to get as much sunlight as possible, and as much daylight. Even if it's cloudy, it's really important, because it helps regulate our hormones and regulate our night our day-night cycle. And also getting out in the sun it helps stimulate our vitamin D. Although I think that especially if we're quite dark skinned, it's probably worthwhile taking some vitamin D3 supplements, because you want to actually increase your vitamin D levels. And you can get advice from your health practitioner about that, but you want to make sure that you're at the right level for your vitamin D. And then the usual things, hygiene measures. Wash your hands if you've been outside, because there are a lot of people out there who have COVID-19 but aren't showing any symptoms. So if you go outside, make sure when you come back in, you wash your hands. So you're doing that regularly. And sleep, that's the other thing. Make sure you get a good night's sleep. It's really, really important. The sleep is a time that your body's repairing itself. And if you lose sleep and you're not getting a good night's sleep, your immunity goes down. So they're definitely things that I would consider.
And I have got another questions related to this. So sometimes we have seen a lot of news and articles regarding the COVID-19, and it says particularly some sort of disease, especially who are suffering from diabetic, or probably if someone has got some sort of disease related to breathing. So they are, what should I say, dangerous for this COVID-19. So how do you explain to those people, who have got this sort of disease, and particularly this time, what should they do?
Well, things like diabetes and high blood pressure, make sure you're taking your medications, make sure you're doing, and it's not just the medications, make sure you're doing the things that your doctor or the nurse has suggested in terms of actually improving the outcome. So for high blood pressure, for diabetes, exercise is really good, because it will bring your blood pressure down and it will control your blood sugars. Eating healthily and avoiding too much refined sugar, too many starchy carbohydrates, will help bring your blood glucose down, and that's really, really important. So it's making sure that you're listening to the advice, but also doing the lifestyle measures. And I would say the lifestyle measures are really, really important. I tend to approach things from the lifestyle measures and then add the drugs, whereas often patients will take the drugs and not do the lifestyle measures, but it's actually the lifestyle measures that will really help you.
Okay. So related to this question as well. So now, I have seen news, I think, few days ago, and it says, so due to the COVID-19, there are a lot of people, they'll be suffering, the issue of mental health. The experts and especially the newspapers are mentioning those sort of news. And what's the reason behind it, and how can people get rid of these sort of things? What's your best advice?
I think the ultimate thing is to be grateful that we have got a health service that can help you. Gratitude is really important, and to sort of be grateful for the things that we have already. It is a very stressful time. A lot of people have lost their jobs, and it is really, really difficult. But we will get through. You mentioned it already. We will get through. There will be opportunities afterwards. It may mean that we need to change the way that we look at things, but we will get through. It's really important to stay positive, because that has such an influence on your own immune system and also other illnesses as well. But the things that you can do to keep yourself mentally well is, again, getting outside, getting a bit of exercise, getting some fresh air, going out. If you've got access to a garden, going out to a garden. If you haven't, maybe going to a park and just walking around, making sure you get enough sleep, and probably avoiding social media as well. I mean, stay connected with people. These, programs like this is really good because you're actually planning your future. And interacting with people socially is very good, but just sort of scrolling through Facebook or Instagram is probably not the best thing to do, because there's so many frightening stories, so much anxiety-inducing things, that it's not really good for your mental health at all. And having a break. And if you do want to check social media, maybe say, I'll check it before my evening meal, or after lunch while I'm having a cup of coffee or something, and then just leave it for the rest of the day.
Um, Thank you very much for your time again. I'd like to tell it time and again. So, we know, I mean, right this time, I mean, people, the profession like you, I mean, who are serving people, I would say they are the frontline people, I mean, who are helping a lot of people out there. And even, I mean, we are afraid and scared of this sort of disease. And still, I mean, considering those sort of things, you go for his job and you help people. This is the awesome service. I mean, would like to thank you again for that.
Thank
To all the NHS staff. So still, I mean, you have got a lot of passion about serving others, helping people, and would like to see them, whatever the disease they have got, I mean, they relieved it and they become cured. And still, there are a lot of people, they would like to know how is the job market for the doctors, especially who want to serve people, as well as, they have got family as well, and they would like to, I mean, support themselves. So what sort of salary or categories and what sort of other benefits, I mean, the doctor have got right now?
I think being a doctor, it's a privilege being a doctor, and one of the benefits is that people do respect you. In terms of finances, the sort of ending salary is fairly good, but the amount of work that you have to do is high. The one thing I'd say, there's always a market for doctors. The salaries might not always be matched, but the thing about being so highly trained is that you are very flexible in your approach, and you can do lots of different things. I mean, we can travel easily. We can. I'm starting up a different practice, so looking at medicine in a more holistic point, from a holistic way. There's lots of different opportunities, but if you're going in just from a financial point of view, there's probably better careers to look at. In terms of respect, in terms of intellectual stimulation, it's a great opportunity. In terms of helping people and making a difference to people's life, it's a really good opportunity as well. Yes, there'll be a standard salary, but there's a lot of work involved as well. So there may be other ways in terms of finances, but it's definitely an interesting profession to be in.
Okay. And yeah, we got you. And still, we have got a lot of respects for the people, I mean, who are working in this industry, saving a lot of people's life right now. So I have got different questions, especially for the Asian and African moms. So probably they came from different countries or from Asia or Africa, and when they settle here and they would like to see their children, they would like, I mean, to be a doctors, but probably probably their children, they don't have I mean, some sort of similar passion. Probably they are very, I mean, interested in doing the business courses or IT, probably they have got. So what sort of advice do you have for the parents, especially, I mean, who'd like to see their children as a doctor, but their children don't want to become that?
I think with everything, when there's a different opinion, it's worthwhile having that conversation and finding out, giving yourself the opportunity to explain why you would like them to become doctors, and then also giving them the opportunity of saying, well, what they want to become, because in the end, you want them to be happy. And I know, and unfortunately, there are a lot of doctors that are unhappy. Part of my job is looking after sick doctors. We have a lot of sick doctors. So you want your children to be happy and to be fulfilled. But I think that starts with having a conversation. The other thing to think about is maybe allowing, not allowing them, but encouraging them to do something that they're passionate about. But they can always come back to medicine. Some of the best students that I've seen, the best doctors that I've seen, are ones that have done other degrees and then come into medicine. There's lots of opportunities to become a doctor as your second degree, and I think that gives you a lot of life experience as well. So don't sort of think there's only one path into medicine, but I think the really important thing is to actually have that conversation with your children, because it might not be the best thing for their personality. There's a lot of work, there's a lot of shift work, there's a lot of sacrifices that we need to make. Yeah.
Okay, so there is a proverb going on, and it says, I mean, if you'd like to go to heaven, so die fast. So, and as you are reminding us, I mean, a lot of time that it's a lot of work, and you have to go through the whole journey, and so that's why I think the parents should consider, first of all, I mean, what sort of amounts of work they have to do, I mean, considering their children, and if they, I mean, release some sort of pressure, if they relieve them and if they allow them to do what they want to do, probably there's going to be some sort of better recommendation for the parents.
Well, I think really think about why you want them to do medicine. If it's because of the prestige, if it's because of the financial security, if it's because you wanted to become a doctor and you want to live your life through them. I mean, really think about what it is. There are lots of jobs that will give you financial security. There's lots of jobs that will give you prestige. There's lots of opportunities to help people. But I think actually having that conversation, it is a really good career, and don't get me wrong, but I think you have to go into it with open eyes. And as I said, I work a lot with sort of doctors that aren't that well, and there's a lot of them, not just from sort of Asian or African backgrounds, but also sort of local backgrounds that say, well, perhaps medicine wasn't the right career for me. So it's always worth having that conversation. But there's always other ways back into medicine as well. So if somebody decides that they've done a degree in something else, they get good grades, they can get into medicine. I know speech therapists, I know physiotherapists, I know people that have done degrees in music, in history, in law, and they've gone back into medicine.
Okay.
Yeah.
So thank you for sharing that. And now I'd like to ask you a very personal question. So Dr. Fayaz. So apart from Dr. Fayaz, who is Dr. Fayaz? What else?
What else? Well, I'm a mum of 4, so I've got 4 children. My youngest is 11. She'll be 12 this month. So none of them, the 3 older ones, haven't chosen medicine. One's a pharmacist, one's doing English, and the other one wants to go into business. I enjoy traveling, I enjoy reading, I coach, I mentor a lot of people, and I have a business interest where I help people set up businesses and become financially more strong, more secure.
Okay, got it. So the next question is, now we can see she's a busy mom, she's a coach, she's a doctor as well. So in, let's say, 5 to 10 years time, I mean, what sort of future plan have you got? What sort of things you'd like to achieve? If you'd like to share with us, probably that might inspire and motivate us to, I mean, get whatever we want.
Okay, my whole passion is actually, not only with my own children, but with my patients, is to empower them and to educate them. So I'm at the moment developing some training courses for people to improve their health, and I'm doing a coaching program with that. So that's something that I want to continue, so that people can actually have more control over their health. Healthcare is changing. We're going to be, as doctors, we're going to be more in a coaching role and help pointing people to the resources they need. So I'm going to grow with that. I've got my functional medicine clinic where I can really sort of deep dive into the root causes of people's problems, and then probably just enjoy traveling with the kids.
Okay. So as you shared with us that you have got some sort of program, so can you please share a bit more in details? I mean, what sort of things and the program for whom? I mean, who can be benefited for the program? And so, yeah.
So the program's aimed at anybody with an interest in health, their own health, and improving their health, and not just in dealing with the symptoms. It's actually really deep diving and looking at what nutritional factors, what mental health factors, what toxins may have caused that problem, and to sort out those root causes and help them move towards more health. So I run a group called Fabulous and 50. It's not just aimed at 50-year-olds, but it's aimed at people that want to have a healthy life even when they mature. So and perhaps for whatever circumstances, they've not been able to focus on their health, but they've realised that it's an important thing to do, especially to have a good old age. So I've got a group that I run, and I do a lot of work on Facebook, so they can find me on Facebook too.
Yeah, viewers, I mean, if you'd like to be healthy and if you'd like to, I mean, sound healthy till 50, then, I mean, this is the person you can join and you can get advice and get some sort of workshop or training from her. So Dr. Fries, what's the best channel to connect with you? I mean, where people can find you?
Probably Facebook, actually. I spend a lot of time on Facebook doing talks and things, and I've got a group that I run in Facebook, and then or you could also sign up to a newsletter which you can find on my Facebook profile as well.
Okay, so is it okay? I mean, if we just at the end of the Facebook Live, so if we just put them on the top so that people can, you know, connect with you and they can communicate with you more.
Yeah, that's great. That'll be really good. Yeah,
Okay.
love to hear from you viewers.
And so before finishing it, do you want to share anything else? I mean, probably I might miss. I mean, I haven't asked you yet, but you'd like to share.
I think if you've got a real desire to do something, go for it. And I think the best thing to do is not overthink it, is just to take action. Connect with people like yourselves who will help you to make that dream become a reality. And if it doesn't work out, what have you lost? You've gained a lot of experience, and you'll have met some really helpful people through that journey. So just go for it.
So thank you, viewers. Thanks for your time, and I'd like to thank Dr. Faiz again. So it's been, I mean, around 40 minutes. I mean, she spent time with us, and we appreciate that. And hopefully, would like to see you and would like to learn from you a lot in the future. So thanks for joining.
Thank you. My pleasure. Thank you.